Welcome back to the Healthy Department, where we bring you conversations that help build a healthier Greenup County, one family at a time. Before we get started, don't forget to like, subscribe, and share this podcast so you never miss an episode and can stay connected with resources right here in our community. Today, we're joined by Sean from Northeast Head Start, located in Flatwoods, Kentucky. Sean is here to talk about what an incredible program that supports young children and families in our area, and why early health screenings and exams are so important to set kids up for success. So let's get started.
Greenup County Health Department. Our legacy of health lives on. Greenup County Health Department. Public health is public wealth.
Sean, thank you so much for being with us today.
Thank you. Thank you for having me.
So to start us off, can you tell our listeners a little bit about Northeast Head Start and the families you're serving?
Yes, ma'am. We service usually lower income families, although we do take, as I said, higher income, over income families. It's limited, but we can take them. Usually the families we serve are ones that receive SNAP benefits or are on TANF list. Our kids, we service them. We make sure they have everything they need. When they come in, we fill out an application and get them started in the process. Once they get started, then we go more into, before they start, they have to have the physical, vision, dental, and all the other. Okay.
So what ages are you primarily working with?
Well, we have several centers across several counties. The one here in Flatwoods, our Flatwood Center deals with ages 3 to 5. We do have what we call early Head Start, which is 0 to 3, and then they will transition, usually about 6 months before they turn 3, they'll transition into Head Start classrooms. They take them over for about an hour or so every week or so and get them used to it, and because it runs different. Where our Head Start classes are more focused on, education-wise. I mean, they teach them in the early too, but, early they focus on a little bit more common stuff, getting them to learn, and because the easiest way to look at it is a child is a sponge, especially from the ages of 3 to 5. So they're getting them, they just absorb all the information. So we're trying to get them ready for success by transitioning them to Head Start from our early Head Start programs.
Okay, so what makes Head Start unique compared to some other early childhood programs? One
of our biggest things is we're all free. Federally funded, it's free. We assist, meals are provided for, breakfast, lunch, and snacks. Wow. Diapers, we assist in toilet training and potty training. So, all that's covered. The parents are not out one penny.
Okay, that's awesome, especially because childcare can be so expensive these days.
Oh, yeah. And I'm going back 20 years with my daughter, and we were paying $100 a week. So, that's $400 a month. Mm-hmm. So and I'm sure it's went up, tremendously since then.
Mm-hmm. Yeah, I think, working with some families, you hear a lot of times that even just one parent working can cover child care costs now. So, sometimes that's why families don't have both parents in the home working, because one whole paycheck could just go directly to that child care.
Yes. And then we deal a lot too. Some of our parents are disabled. Mm-hmm. So, and we try to assist with that in any way we can.
Okay, so you're helping the parents get connected to resources too.
Exactly.
That's awesome. So what kind of services do children and families receive through this program? Well,
when a child comes in at the beginning of the year, one of the main things we do is we do what we call Dial 4 testing on every child. It checks their concepts, language, speech, everything like that. If they pass it, we usually don't have an issue. They keep going on their normal pace. If a child scores low on that, then they will do what they call RTI, which means I can't think of the acronym. It's RTI, but I can't think of response to intervention.
Okay.
And they basically work with that child. And they'll take them a little, start out and we'll just work in a smaller group. So we're going to put you with 5 other kids, and we're going to kind of give you a little extra help.
Yeah.
And if that doesn't work, the RTI doesn't work, we do a referral to the local school systems, and we can get IEPs in place, or we start out with ARC meetings, and then they can get individual education plans in place, and that'll follow them as long as they need it. It re-ups every year, and the ARC team meets together, and everything's decided for that child, and so it's not just one person saying it. There's a group of us that come together.
Okay.
So we all have that best interest of that child to get them the help that they need.
Mm-hmm. That's great, because especially I know too with larger classroom settings, that individualized support can really be helpful in small group settings as well. So what's your average about class size over there?
Well, for early Head Start, we can have 8 in the classroom.
Okay.
And there are usually co-teachers and an aide with them. Now, once we get into the Head Start, they can have up to, I think, 20 per class. And it's, again, 2 co-teachers and a teacher, an aide, and an assistant teacher.
Those are pretty good class sizes. That's awesome. And it's not too big either,
No, it's not. You know everybody, all your children usually on a first name basis, and they work they grow close and work with kids and give them all the help they need.
Yeah, that's great. So for families listening who might be interested in Northeast Head Start, how does that initial enrollment process work? How do you guys get set up?
Well, they would contact, here it would be the Flatwood Center, Carter County. There's 3 centers. There's Olive Hill, Gregoryville, and Grayson. There's 1 in Louisa, and then we have 2 in Elliott County. So they would contact that center. Here, like I said, it would be Flatwoods, and they would speak with Deb Sowards. She's our family advocate there. And she would bring them in. They would fill out an application, and they would get started on that end. Once the application's filled out, if they'll have to have a birth certificate, a social security card, proof of immunizations on a Kentucky form, and then physical, dental, vision, all those. And we need all those, for them to be able to start.
Okay. And so what about for families who may be thinking, this program sounds interesting, but, I don't have the means to get my child to Head Start or pick them up, maybe conflicting work schedules. Is there any transportation access for these families?
Actually, yes. We provide busing.
Oh, wow.
And we have, like Flatwoods, we have 2 buses that run. One runs out in Greenup and South Shore. The other one runs to Flatwoods and Russell. And, they pick up our kids. One of our centers we have in Elliott County the busing is handled by the school district, but the rest of the centers are all us. We offer transportation at all of our centers.
That's great. That's awesome, because transportation can be a huge barrier for some families.
It can.
Yeah. Okay. So, and then is there any, cost associated with applying? Like, how does that work?
Nope. It's all free. They just come in and fill out the application and get things started.
Wow. All free. That's, almost hard to believe, but that's amazing.
Exactly. And that's one of the biggest things we push too. And we let them know, your child's getting a quality education and they're getting it for free.
Mm-hmm. Yeah. So, you can't beat that, especially a good free education. So, once you're getting applied, and you said that there's some screenings, immunizations, everything that they have to complete there. So, that's kind of one of the things we really wanted to highlight today, too, is the importance of making sure children have their health screenings and exams completed. A lot of people think with health screenings, that's mainly for adults, getting them checked out, but it starts as early as childhood.
Oh, yes. And a lot of schools require that you have the physical and the dental and the vision before you start. Mm-hmm. And if they have it for us, that's just transferred to the school. If we have it, we just send it on when they transition into kindergarten. So that way they already have it. They'll have their birth certificate, social security card. They'll have their dental, vision, and physical.
Okay.
So all that stuff just goes right with them. And it makes the process a lot easier. That way the parent doesn't have to fight through it again. And, you know.
You guys already have all those records.
Yeah.
Nice. Yeah, that's
and
awesome.
We send it to them. To the schools. One of the biggest things we are dealing with, and especially in our community now, in our area we're seeing, is the lack of dental care. I know Greenup County has, the health department has their dental. That's really helped a whole lot. you don't know how much it's helped. But before, we're looking at dentist appointments 6 months to a year out. And now we're starting to see the same thing with the vision appointments.
Really?
And it's becoming a thing, Medicaid doesn't want to cover. Or they only want to pay so much. And then it ends up,
making it harder to get
making
scheduled.
it harder. And a lot of the dentists and the vision doctors now are saying, no, we'll just stay with private insurance and we won't have to use it.
Yeah.
So who's it hurting in the long run? It's hurting the children and the people in the community.
Mm-hmm. Yeah, I can agree there. It gets tricky with the insurance coverage and all that. So why do you think these exams are so important for young children to make sure they're getting done?
Well, it helps our staff and our teachers, and me being the health and disabilities coordinator, it helps me learn a little bit about that child if they have, any specific details where they might have hearing problems. We do hearing screenings. If they have vision problems, a lot of that can be, and bring them back to, I guess, I don't want to say a lower standard of learning, but it can hinder their learning. So, we want to try to give that child every fighting chance that we can. Mm-hmm. So, a lot of times we can look at a physical, we can look at a vision, we can look at a dental and see, okay, well, this child's not talking right. Well, we can look at a dental record and say, okay, well, he has a problem with his mouth size being too small. Mm-hmm. So we will make, the referral to speech or, and a speech therapist can look into it. And if a child, has problems seeing or, needs glasses, then we make the referral to, the Lions Club or somebody who can assist in that end.
Yeah, that's great. And that's so interesting you mentioned that, because I have a friend actually who was telling me one time when she was younger, in about Head Start age, she had, I guess the hardest time seeing. Well, she finally, through the Head Start, got the screening done, got a vision test, and they were able to give her glasses. And she said she remembered crying because she could finally read. Like she could finally look at things her teachers were giving her, and she was able to see them. Mm-hmm. So you just think about the differences in these kids' lives that you're making. It's pretty awesome.
And, and it does. It makes a big difference. Mm-hmm. And to them, they can't express that they can't see. They don't understand that, hey, I can't see what you're doing. So,
to them,
how does a 3-year-old express that?
Mm-hmm. So, because they might not know what you're supposed to see, quote unquote. To
them, that's completely normal. Mm-hmm. So, when they can actually, we find that there's a problem and we get them referred to a vision doctor or somebody that can help them. It's like somebody flips on a light switch.
Mm-hmm. Wow. Yeah, that's great. And so, that's kind of a good example of what can happen if the screenings are delayed or not completed. It prolongs that not getting treatment, and then it could delay the education process. So,
and everything revolves back to education. Mm-hmm. It all circles back around.
Mm-hmm. Why is it so important for families to get these exams completed in a timely manner? You think that's...
Well, our regulations state that, our performance standards state that they have to have them be able to start. So, we want to make sure that they have them up to date. Some may have already had them and started, and they might expire in December. So we, would let the parent know, the advocate would let the parent know, okay, this appointment's coming up, he's getting ready to expire. He'll need a new physical, or they'll need a new physical, they'll need a new vision, they'll need, whatever they need.
So that's great. You're helping the family stay on track too, because with work and, other kids in the house, it can get crazy.
Yes. And like I said, mine's in college now, and it's just me at the house, and it still goes crazy. Mm-hmm.
So do you guys have, and I know, we work with you some here at the health department getting family services, but are you connected with other providers in the area to help?
Yes, actually, if we see like behavioral issues or anything in a child, we can refer out to several areas. We have Pathways, Mountain Comp, we maybe Regroup, Little Roots. Yeah, we work with them. And if a child has behavioral issues that we're seeing, or they can't quite focus in the right way, then we'll, contact the parent and say, hey, we're noticing this. Have you noticed this? Can we get together and we'll talk to the parent, and then we'll see if we can, maybe do a referral for them. And they can give, help on their end as well, that helps the family and helps the child.
Mm-hmm. Yeah, and that's really great too, because there might be factors outside of the classroom that's really affecting the children, learning in the classroom.
Mm-hmm.
So providing those services that can kind of help kids talk about something they may not want to talk about in a school setting. That's great that they can have that space to do that.
Yeah, and a lot of times too, we have, like I said, our school-based counselors come in. The ones with the children's with the IEP, they'll come, the speech therapist or the other therapists, occupational therapy, physical therapy, they'll come into the schools there, and the parents, don't have to take them anywhere. They see them at the school and work with them. So a lot of times they can go to the home and work with the parents in the home.
A lot of different opportunities to get families connected with these resources, because again, that transportation or even just having time to get to appointments
exactly
can be difficult. Okay. So for some families who may feel overwhelmed or unsure of even where to start, what advice do you maybe have for them?
Start early. Go ahead and start reaching out to your centers, our dinner centers that we have, and find out about getting started, what they have to do, what all they need. And they'll tell them everything they need to have, and then they'll set up a time to come in, and they'll fill out the application with them, make sure they have everything they need. If they don't have everything, they can help them get it. We have some children that may, don't have the right birth certificate. So we have to, we'll assist them with getting a birth certificate. If they don't have the Social Security card, they've lost their Social Security card, we can work with them. Okay, this is who you would talk to. Let's go down here and let's see. If they can't get transportation there, we can help provide, transportation. The family advocates go get the parent and take them down and help them any way they can.
Yeah, and that's another great thing, because a lot of these processes too can be overwhelming. You don't even know where to start.
Oh, tell me. Yes, I know. And, like I said, with kindergarten, they'll still have to fill out when they transition to kindergarten, the parent will still have to fill out the paperwork. We're there to help. The teachers are there to help. We work with them. We're going through right now, and Olive Hill today is going to doing their kindergarten transitions. So they're going to what they call the big kid school. And, they get to see the big kids and see where they're going next year and how everything works and kind of just get a feel for it.
Yeah, that's great. Kind of like an early exposure kind of thing.
And, this wasn't around when I was growing up. I mean, when I was growing up, I remember going to middle school. I was so used to grade school, and then all of a sudden here's middle school, and now I got to start switching classes. And
it's a whole new world.
Yeah.
Wow.
So.
Okay. So, and that's great. You are working with a lot of these different services and getting parents connected and finding the right ways to get documents and stuff like that. Again, because that can be so challenging sometimes, especially when you are just either playing phone tag or, it can be a long process.
It is. And a lot of times too, you might call for an appointment, like I said, with a dental, and it may be 6 months to a year out. And that's what we're trying to work with the local dentist and with you all as well in your new dental program. And I think you all do the screenings on our kids now at Flatwoods, and they love it. I hate to say, I never thought I'd ever hear a kid say they like the dentist, but when they come in, the people are very nice with them. And
our dental girls are
very gentle,
and
reassure them, because that's scary to a child, and especially that a parent's not there. So they're seeing them in the schools, and if they have an issue, if they have problems, we alert the parents and say, okay, well, the dental tech was in here today and they happen to see this. We might need you to make an appointment, and usually they will do that. Dr. Mussetter, like I said, she works wonders, and she's a great dentist. It just takes some time, because she's the only one in the area that does the pediatric dentistry. I believe talking to her, she said it was Maysville, Moorhead, and here. That's the 3 pediatric dentists. And that's showing you the space in between them.
Yeah, it's very limited around here. It's one of our biggest challenges, and one of the main top priority issues on our community health assessment was dental concerns. So, hopefully we're looking at expanding that dental program a little bit more that can help the preventative side of things for our county, especially getting in with Head Start. That age, that helps them kind of get used to that process, and I think that's great.
And it's the area, too, where we're, it's such a rural community, in the bigger cities and towns like Lexington, Louisville. I'm sure they probably don't see this as much as we do. But for us, being a rural community, we don't have a lot of that.
Yeah, the access to care, it's very limited. But, hopefully in the future we're working on expanding, and like we do here with you guys and a lot of our other community partners, we collaborating,
Yes.
I think is one of the most effective ways, because that's how, word of mouth gets out.
Exactly. And we have Facebook, we're on Facebook too, but, that's just one little tiny part of it. I would love to see us incorporate, TV, radio, podcasts, get our name out there. We've been around since the 60s. So,
yeah. And what you guys are doing is great. That's awesome out there in Flatwoods.
Well, thank you.
So, Sean, before we wrap up, is there anything else that you'd like our families in the community to know about Head Start, or just the importance of these early health screenings?
The early health screenings we need them. It helps us to identify issues with the children, if any. Other than that, we're getting ready to open enrollment here before too long. So please, you can, if Flatwoods, if I can give the number, it's 606-833-2826. You can ask for Deb Sowards. She'll probably be the one answering. And just set up a time to come in and fill out an application. If people in Carter County here, just call their local centers, and we can, like I said, we have one in Olive Hill, one in Grayson, and one in Gregoryville. So they can call that center, each individual center, and we can get them set up and get them started.
Well, that sounds great. Yeah, that's a great way, super easy way to call and just get connected and get that initial meeting set up. So thank you again, Sean.
Well, thank you for having me. I really appreciate it.
It's been a great episode learning about what all that you guys offer over there at Northeast Head Start.
And one other thing, too, we're having a health fair come up on May 22nd, and it's for staff and community. So if, staff wants to come or community, they're welcome.
Yeah, we'll be there.
And it'll be at the Flatwoods Center as well.
Yeah, I think we're doing a little bit of health screenings there. There'll be some information on smoking cessation, and then I'm sure you guys will have information about your enrollment.
Oh, yes, definitely. Most definitely.
Well, it sounds great. We look forward to seeing you there. And if you have a young child, and you're looking for support, education, and resources, Head Start could definitely be a great fit for your family. And remember, staying on top of your child's health exams is one of the best ways to set them up for success, both in school and in life. So don't forget to like, subscribe, and share the Healthy Department so we can continue bringing helpful conversations like this to our community. We'll see you next time.